Good. All right, guys. So this is the first one. How does asthma work? Um, we will look at it and then we'll have a discussion with it afterwards, okay?
It starts with a cough or a wheeze. Soon, your chest feels tight. Your breathing speeds up and gets shallower, making you feel short of breath. These are common symptoms of an asthma attack. Around the world, more than 300 million people suffer from asthma, and around 250,000 people die from it each year. But why do people get asthma, and how can this disease be deadly? Asthma affects the respiratory system, particularly the smaller airways, such as the bronchi and bronchioles. These airways have an inner lining called the mucosa that's surrounded by a layer of smooth muscle. In people with asthma, the airways are chronically inflamed, which can make them hyperresponsive to certain triggers. Some of the many asthma triggers include tobacco smoke, pollen, dust, fragrances, exercise, cold weather, stress, and even the common cold. When people with asthma are exposed to these triggers, an asthma attack or exacerbation can occur. But how exactly do such everyday factors lead to an asthma attack? If an asthmatic is exposed to a trigger, the smooth rings of muscle that circle the small airways in their lungs contract and become narrow. Simultaneously, the trigger worsens inflammation, causing the mucosal lining to become more swollen and secrete more mucus. Under normal conditions, the body uses this mucus to trap and clear particles, like pollen or dust. But during an asthma attack, it blocks the narrowed airways, making it even harder to breathe. These effects lead to the symptoms of asthma. Smooth muscle constriction results in the feeling of chest tightness. Excess mucus and increased inflammation can cause coughing, and the wheezing noise? That happens because as the airways constrict, air whistles as it passes through the narrowed space. These symptoms may make a person feel like they're running out of air. Yet counterintuitively, during an asthma attack, the inflammation can make it harder to exhale than inhale. Over time, this leads to an excess of air in the lungs, a phenomenon known as hyperinflation. The trapping of air inside the lungs forces the body to work harder to move air in and out of them. Over time, this can lead to reduced oxygen delivery to the body's organs and tissues. Sometimes, in untreated severe asthma attacks, the body can't keep up, which can lead to death from lack of oxygen. So how do we prevent these uncomfortable and potentially fatal attacks in people who have asthma? One way is to reduce the presence of triggers. Unfortunately, the world is an unpredictable place, and exposure to triggers can't always be controlled. This is where inhalers, the primary treatment for asthma, come in. These medications help asthmatics both control and prevent their asthma symptoms. Inhalers transport medication along the affected airways, using a liquid mist or fine powder to treat the problem at its source. They come in two forms. There are reliever medications, which treat symptoms immediately and contain beta agonists. Beta agonists relax constricted muscles, allowing the airways to widen so more air can travel into and out of the lungs. The other form of inhalers serve as preventive medications, which treat asthma symptoms over the long term and contain corticosteroids. Corticosteroids reduce airway sensitivity and inflammation, so asthma can be kept under control. They're also crucial in preventing long-term damage from chronic inflammation, which can cause scarring of the airways. Inhalers are known to be very effective and have helped many people live better lives. Although we've come a long way in improving how we treat and diagnose asthma, we still don't know its exact causes. We currently believe that a combination of genetic and environmental factors play a role, potentially acting during early childhood. Recent research has even linked poverty to asthma incidence. This may be due to reasons ranging from exposure to additional pollutants and environmental irritants to difficulties in obtaining medical care or treatment. As our understanding of asthma improves, we can continue to find better ways to keep people's airways happy and healthy.
All right, guys. So let me get your questions on that. Any questions on asthma? Tell me, anybody asthmatic in class here? Well, I'm asthmatic. Yes, Abigail.
Hi sis. So when somebody has asthma, it's something that they are born with or they can develop it.
Typically, most people asthmatic may be born with it, but yes, depending on the environment, you could develop asthma as the years go by.
Okay.
Anybody else? Anybody? All right, so here's my question. You're a first aider and you encounter a patient, let's say you're in class in Costa here, right? And you're at Shoguna's campus. And you're told that one of your colleagues is having an asthma attack. How do you think you can assist this person?
So, like, I'm not quite sure, right? But is would giving CPR help them
Mm-mm,
or mouth to mouth
mm-mm,
resuscitation?
mm-mm. You guys looked at the clip? What you saw on the clip there?
The inhaler.
Mm-hmm. All right. Anybody else want to help Abigail here? What's the first thing you want the person to do?
Sit down.
That's right. Sit down. Why? Anybody knows why? Again, let me just pause the recording here for this. Right. So remember, your body needs oxygen. And as you move around, your heart rate will go up because your body has an increased demand for oxygen and nutrients. Now, in order to get that increased supply to meet its demand, the heart speeds up, increases its pumping rate because blood acts as a transport medium for oxygen and nutrients. Remember, oxygen is attached to the red blood cell, in particular the hemoglobin. So, increased heart rate, blood circulates faster. Right. Somebody who's moving around and is having difficulty breathing, whatever available oxygen in the body is going to be used up by the muscle tissues and stuff. Okay. And with a narrowed airway, you're going to get less air coming in, even less air being exhaled. So you're going to get a hyperinflation of the chest in the case of an asthma attack. And as a result of that, the available oxygen level diminishes. That's one of the reasons why you want the person to sit down and rest. So if they were moving around, have them stop what they're doing, sit down. Second thing, anybody who's ever experienced any difficulty breathing. So tell me something, anybody here ever had the flu so bad that when you lie down to sleep at night, you felt as though you were suffocating? So you had to use another pillow or you had to sleep, you had to sit up a bit or lean back a bit instead of lying flat. Anybody?
Yes, sir.
Right. So imagine that magnified 100 times fold for an asthmatic patient. Right. Anybody with tightness on it, anybody who is having an asthma attack, the chest feels tight. So anything on the chest there will make you feel as though it's getting worse. So typically with asthmatic patients, what we want to do is loosen tight clothing. So for example, we may want to unbutton the shirt. Okay? That is within reason as well, because we have to look at, in the public domain, we have to try to maintain the person's privacy. So I don't expect you, with a female patient, to go and unbutton the young lady's clothing and go and cut the young lady's bra and have her business exposed for everybody. Okay? What you may want to do is try to ensure there's some privacy for her. So, for example, if you're in a classroom, right, you may ask the others to leave the class while you calm her down, and then depending if there's some undergarment underneath, if she's wearing a shirt, and you can unbutton the shirt without exposing her business to everybody, then great. If not, try to manage as best as you could. Okay? The advantage we had on the ambulance is we carried the barrier gowns. So typically, very quickly, we'd put the patient in the ambulance, unbutton the shirt, and put a barrier gown around her, right? And it's all in an effort to maintain the patient's privacy, because once the difficulty breathing has been managed, then everything exposed here. We want to be able to manage that as well. Okay? So we try our best with our patients. Right. So we have the person stop what they're doing, sit down and rest, loosen tight clothing. What else you think we need to do? Anybody else? Somebody help out Abigail here. Yes, Miss
So,
Morticia.
so I will have them sit upright and administer the puff to them if they're unable to. Help them to like slow down their breathing as well, or to
Right.
manage the breathing.
Okay, so yes, we want to, if the person is asthmatic and they have the puffer, get the puffer. Now at this level, you cannot administer it to them, right? But you could get it, you could take the cap off, you could shake it and all those things, put it in their hand, let them administer it to themselves. Excuse me. Obviously, if the person is unconscious, we don't want to be administering anything to anybody who's conscious or who appears disoriented and those things. Right. Somewhere along the line, yes, a call should have been made to get either if there's a nursing cost start, if there's a trained first aid, or if not, then some call should have been made to have the ambulance responding. Okay? Everybody clear on that?
Yes, sir.
Anybody has any questions? No questions?
No, sir.
Okay, so now a little point to note, right? Anybody who has ever experienced any sort of stifling, suffocation, or difficulty breathing will know it's very easy to panic. Keeping the person calm is one of the most critical things you could do for these patients. Okay? Right. So if we have no questions on asthma, I'm going to start the clip on a heart attack, and I'll share it with you guys. And we'll have a discussion on heart attack when the clip is finished. All right, so I think I'll just go mute for a bit. I'm going to share the clip. A quick one. Can you see it on your screen?
Yes, sir.
Okay,
Yes,
good.
sir.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes, will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
Okay, question time. Let me hear you guys.
Does kind of heart attack happen to anybody? Like
Anybody,
anybody?
any person could have a heart attack. All right. Some people, so typically, you might expect, or the general consensus is, as you get older, you have an increased risk, right? Typically based on your diet and the buildup of plaque on the inner wall of the artery and well, the narrowing of the vessel. As you get older, you naturally lose the elasticity of your blood vessels. So that's another problem there, right? The family history is a critical one as well, okay? And those things increase your risk. Now, some people may be born with a congenital defect. Like a colleague of mine, his daughter was born with a problem with one of her heart valves, and her treatment and the corrective surgery could not be done in Trinidad. So, they would have reached out to the personnel with the Children's Life Fund, and they got the approval, and her surgery was actually done in the States, and she's pretty good now. But some people are born with a congenital defect, and that could trigger them, depending on what type of defect it is, they could have a heart attack. So yes, it could happen to anyone at any age. But the general consensus, looking at the data, is typically as you get down into the older years, let's say, as you cross, I believe if I remember correctly, as you cross 50, you should you should consider yourself at increased risk and all those things, right? Somebody put something there as well on the chat. Anyway, right, so I'll see about that. Right, yeah. So guys, just the public service announcement. Type in your names on the chat, please, as a record that you were in class today, okay? All right, yes. Questions? Any other question? None? Okay. My turn to question you guys. So, you're at school again, and you see someone walking towards one of their classrooms. Excuse me. And suddenly, this person grabs their chest, right, and doubles over. They didn't fall down, they're standing, but they bend over, clutching the chest. Okay? You know a little bit of first aid. What you going to do from there? Tell me. What do you think you want to do? What would you do? Miss Jordan, tell me what you do. Uh-huh. Be honest.
So
Be honest with me. I like people to be honest. If you think you're gonna panic, if you think you're gonna call for help, if you think you're gonna freeze, be honest with me. Right?
I feel I will do a little bit of all,
All
but assess the situation and see if I could assist. If not, then I'll call for help.
I
But
like that.
give
I
I
like
know
that.
a little bit of first aid. I probably will check to see if they're having a pulse,
Uh-huh.
how fast the pulse is.
Uh-huh.
Um, because it don't have to necessarily be a heart attack. It could be a panic attack. So you could
Good. I like that. I like how you're thinking.
encourage
So
people to have
so
a
thank
seat
you.
to relax.
Yeah, thank you for that. And I appreciate the fact that you say you probably do a bit of all. So it happens. Every single one of us, typically, if you've not been involved in emergency care or in healthcare on the whole in terms of managing patients, it's gonna stun you. It's gonna shock you. The first time I attended to a patient in what we would, the layman's terms would be a full-blown massive heart attack, I was stunned. And here I am, an EMT who is supposed to assist this person on the ambulance. They're looking to me for guidance, and uh, my mind went blank. But of course, the training kicked in, and naturally, at that time, there was an issue with liability and stuff. So all the aspirin and the nitroglycerin, because we had nitroglycerin as a spray, not the pill to put under the tongue, right? We had it as a spray. There was an issue with the Ministry of Health and the management of EHS and all those things. So because of that technicality, they ended up removing all the medications except oxygen on the ambulance. Even the EpiPens and all those things were taken off for a period of time. So my training kicked in. Yeah, all what you need to do, obviously, and you need to assess, right? Excuse me. Naturally, if this person double over, the first thing you want to do is figure out what's going on. Remember, you identify yourself. So you walk up, you say, "Hi, good morning. My name is Kimberly. Can I assist you?" All right. And obviously, some person say yes. Well, okay, tell me what's going on. Guys, let me make it clear. This is not about show or showmanship and ego and stuff. This is real life. Okay. Every single patient I've attended to, and I've attended to thousands of patients over my career. And every single one of them, I always start by identifying myself. Hi, good morning. Uncle, morning. My name is Nigel. I'm an EMT. Can I help you? Okay. By getting the person to respond, and the person simply says morning or yes, help me, boy. You know the contrast, you know the breathing, there's a heart beating, and so you get those things. And then the next thing, finding out what's wrong. Can you tell us? So what's your problem today? What's going on? And the reason we ask that is for the person to tell us what they're experiencing. They getting chest pain? Pain, boy, pain, pain. Where you getting the pain? And one of the things I do, we were taught this for children, but it's something that works really, really good for adults as well, right? If you tell them, so if you tell them, show me where you're getting the pain. All over, boy, all over, and then they're rubbing the whole chest and stuff. But if you tell the person, can you take one finger and point where you're getting the pain? You might point to the center of the chest, right? Anywhere else? And that way you're getting specific now. Okay, try to identify where they're getting the pain. And of course, we go back to the same thing as in difficulty breathing. Put them to sit down. We need to get that heart rate to drop. That heart rate needs to come down. You try to calm this person. Somebody needs to make that call for help. And what I'm telling you here is about real life situations. Make that call for help. If Costat has a nurse on site, if Costat has a first aid team on site, a first aid on site, somebody within their emergency response system, get that person notified. Okay? Get that person notified so they could take over from you. If you are at work, get the first aider or the safety warden or somebody informed so they can activate the emergency response plan. Organizations who pursue occupational health and safety compliance, within that framework, there's always an emergency response plan. All right. So while I'm talking to you guys, I'm actually looking for a document here from one of my business clients um, to show you an example of what I'm speaking about. All right. I'm just trying to find it here and while we're speaking. So typically, remember, if you're at school, the organization will have an emergency response plan for all these things to be implemented. Okay. If you, oh yeah, actually, I know who I'll get it from. If you are at work, the organization will have an emergency response plan to manage these situations. I'm just trying to find a simple one here and a simple ERP to give you guys an example of one. Right. Right. So back to the first, the cardiac condition, the chest pains. Anything else we want to do while I'm looking for this document? You guys, somebody could tell me if there's anything else we want to do.
So I know where the answer though, but I heard that people saying, everybody is come with their own remedy, that if you're assuming that someone is getting a heart attack, cough the chest very hard.
Right. We'll
But
discuss that shortly. But okay, good. So I got a nice simple one here. Well, not really. It's straight to the point. And situation like that, it does shake you a bit. Yeah, I hear you, Alia. Right. I'm gonna share a document here. Right. Just let me know when it pops up on the screen, please.
Hi, so we can see it.
Right. So this organization, Novo Communications Limited, is one of the subsidiaries of the group that I work for, right? I work for a company called Novo Technologies, Novo International. And Novo Communications, if you live or you have colleagues living down Penal, Bark, or Moruga, those areas, we provide services very similar to TST, well, very simply to Amplia and Digicel and Airlink and those things, right? So part of the job involves working on these poles to run lines, going into people's homes to install cable and all these things. So this is Novo Communications Emergency Response Plan. And if we scroll down under the table of contents, you will see first aid procedures, evacuation. So typically, right, so we have fire, earthquake, bomb threats, right? We see a bomb threat, medical emergencies, all these things, right? And it lists what actions should be taken, right? Now, part of this involves the first aid or the safety warden receiving the training to know what to do, right? The ERP will not tell you at the specific part of administering the care, right? In terms of what the administer oxygen
what
or
boy that is
let me just stop the share here for a sec,
it?
right?
$100 for doubles?
What?
How about doubles again, number?
Oh, don't make joke. $100 for doubles?
Sorry.
Oh gosh, a light-hearted moment, right? But thank you for that. Yeah, so I stopped the share there. The idea is for you to understand that within organizations who pursue HSE compliance and have an HSE management system, there is an ERP. Part of that is having a first aider, and part of that with the first aider is the first aider having the training to know what to do. So let's take that now and bring that back to this situation of the person getting chest pain. We're not sure if it's a heart attack. Acid reflux will mimic a heart attack, right? Angina and a heart attack, you get the same set of pains, but the pain with angina goes away with rest. So we don't take it for granted it's angina. We don't take it for granted is acid reflux. We assume it is a heart attack, worst case scenario, and we call for help. So at work, activate a ERP. Get the first aider notified. At school, get somebody in authority notified so they can activate their emergency response plan. Okay? If you're, let's say, at home or in the mall or in some public place, have the person rest, sit down and rest. Obviously, excuse me. This is one situation where we have to loosen tight clothing. So you have to be mindful how you're doing it to maintain the person's privacy, because this is 2025 and a lot of people will take recordings, will take pictures of these things and put it on social media. I've seen videos of CPR in progress in Maracas or Tyrico or some one of those beaches. I've seen videos online, international videos showing you a shark jumping somebody in half. Things that were not meant to be seen in out there, but people post it on social media. So be mindful of that. Always try to respect the person's privacy, because after the emergency is managed, and hopefully this person makes a full recovery, this person needs to return to work or resume their normal activities. You don't want somebody sharing pictures and videos or clips of this person in a manner that exposes them. None of us would appreciate that, and none of us would feel comfortable and happy about that, especially if it is your brother, your sister, your mom, your spouse, your dad, some family member, right? So think about how you would feel if you see pictures of your relative circulating on social media, being attended to in a medical emergency, and she is exposed. It's not nice, people. Now, the reason I'm telling you this is because it has happened. And if we can, each of us, I hope you never have to attend to someone in an emergency, but if you do, please take this into consideration. Okay? Right, so back to the chest pain issue. Identify yourself, have the person stop what they're doing, let them sit down and rest, loosen tight clothing, get help. Now, if the person is a cardiac patient and they have their medication on them, you could retrieve it and give it to them for them to administer it. Or should I say, let me just say give it to them. That's the wrong choice of words. You could retrieve the medication and have the person administer it to themselves. I think that's the better choice of words. Because when I say give it, it gives the belief that you might be administering it to the person. We don't want that. Retrieve the medication and have the person administer it to themselves. At first aid level, you're not authorized to administer any medication. At home, the Medical Board Act is clear. Nothing in the act affects at home. So if it's a relative at home, feel free. You could administer whatever medication they require that you have or that the person has. Call for help. Make sure you make that call for help. 811. Have the ambulance on the way. Make sense? Anybody? Anybody confused? Anybody concerned? Anybody has any queries, questions?
So I think your reaction to in a situation like that would be important as well. How you
Critically
reacted.
important, but
Because I have been in a situation like that on a previous job where I was drawing the sample, and just as I finished drawing the sample and was ready to take out the needle, the guy, like a middle-aged person, he started to get chest pains right there on me. It wasn't a doctor's office, but it was like right there on me. And I I have panic attacks.
right.
So, my first instinct was to get the needle out. So, stop the bleeding, because you don't know what is going on.
Good.
You don't know what is going on. And within a couple of moments, it's in the doctor, so everybody had to attend to him like an emergency right there.
Mm-hmm.
And the first instinct, well, they had to put him to lie down because his eyes were starting to go down.
Right.
So
He was going unconscious.
yeah, and he
Mm-hmm.
was in and out. So we were just trying to keep him awake and whatnot. So it depends on your reaction to the situation as well. Because
Yes.
if you react a certain way, you wouldn't be able to assess that situation.
Yep. And that's why we talk about you needing to stay calm. But here's something else I'll tell you as well, right? And I'm glad that you guys were in a position to assist them. We have to be understanding and look at the real world here as well, where a lot of people don't attend or respond or were never exposed to managing a patient in an emergency. So we have to understand and accept that there will be a level of panic at some point in time. So we have to make provisions for that. And that's why I'm saying, just as I think it was Miss Jordan who said she would go through all three phases. That's okay. That's fine. As long as somewhere along the line within those responses, we are able to have a level of response being provided for the patient, right? So let's shift from a medical emergency and give you an example of trauma. And I mean, as I said, I have so many experiences with patients, right, where I could draw on. The one amputation I ever went on, a horse bit a child's arm off in Trinidad and Tobago, right? And that was actually in the news. When my colleague and I got there, so we got a call, we responded with the ambulance. The dispatch told us unknown situation initially. When we almost got to the scene, they just came back and they told us it's a traumatic amputation. So we naturally started thinking it might just be probably a couple fingers or the from the wrist or something along those lines, right? When we got there, it was literally 2 inches from the shoulder joint. So that entire arm was off. And this was, let me see, I think this would have been my second year or heading into the third year as an EMT on the ambulance. So I've already managed hundreds of patients, right? And came out the ambulance, my colleague and I, and when we looked, it literally stunned us. Now people are looking to us to provide care, and you have to give yourself those couple seconds to take in the scenario, take in the scene, what is going on, and then you start to process it. People will panic. We know that. How we respond after that makes a difference with the patient. Okay? So, yes, you're quite right. But at the same time, I'd like for us to understand that we have to, even ourselves, give ourselves those couple seconds to assess, understand how difficult the situation is, and then we let logic take over. We start to plan what I need to do. And the first thing is I need to figure out what's this patient's state and get help. Two critical things. Figure out what is the person's state and get help. Okay? Always be an advocate for your patient. They get in chest pains, get them to an area and try as much as possible. Excuse. So if you're in Costa there, let the security help you to maintain a clear area. Keep people away because everybody, oh gosh, you in chest pain, I want to pull out the phone right? Yes, Miss Mortician.
So you start the scenario, but you didn't finish it. So how did you control the bleeding in the child's arm?
That you wanted to find. Right. So we looked at the scene, saw what's going on. The child is on the ground. The arm is like 10 feet away, right? And the history we got is that he was accustomed going into the farm there, the horse farm, and petting the horses. But in this particular period of time, there was a mare in heat, and the stallions were a bit aggressive. So when he reached out, and given the background, right? I know people like to get the entire history, and then we go forward, right? I was actually I was buffed about that in a previous class, so I learned from that. Yeah. So he when he reached out to pet the horse this time, the horse grabbed his arm and yanked on him. So he held onto the railing. So he is suspended a bit with the horse pulling him on one arm and the other arm holding onto the railing. Something that you'd probably see in TV or in those cartoons and stuff. I know, but it's bad, right? I'm not trying to downplay the situation, right? I'm just trying for you to get a mental picture here. And when the horse chomped on the arm now and bit it off, he fell and the horse ran off and then dropped the arm just a couple feet away. So there's a lot of blood. But interestingly enough, when we got there and we got to him, the body had already started to do shunting, where it would have redirected blood flow from this amputated area, from the severed area, to the critical organ, to the vital organ. So there was the initial blood loss was a lot. But interestingly enough, when we got to him, there was very little bleeding. So all we had to do was use one of those large bandages, put it over the stump and stabilize that. And then we got the severed arm. We wrapped it in well, in one of the dressings we have on the ambulance, one of the large trauma dressings. Okay. We put it in a plastic bag. We were able to get ice from a bar, a rum shop, basically, for everybody to understand. All right. That was next to the horse farm there. We were able to get ice from them. We got a bucket, put ice in there, put some water with the ice, and put the severed limb in there. Put some more ice on top of it. A little bit of water again. Right? And the reason we do it like that is obviously we wrap it in a clean bandage or the clean cloth, put it in the plastic bag, tidy bag, so we don't get frostbite setting in to damage the limb. And we headed up to Mount Pediatric. He was in shock because of the amount of blood loss. So naturally with shock, the treatment for shock, our treatment would have set in there, would have put him in the shock position with the legs elevated, put him on oxygen. I'll never forget the look in his eyes though. One of intense fear. I'll never forget that. That stays with you, right? Certain calls stay with you. I'll never forget that, right? And I'm happy that he's alive. We got him to Mount Hope Hospital alive in shock. We were able to inform our comms or dispatch center, and they radioed ahead, informed the hospital that we were bringing in a pediatric with a traumatic amputation. And we let them know what his vitals were, and they passed across. So it's one of those things that what was supposed to be the response actually happened. When we got up to the ramp in the pediatric facility, there was nurses and a doctor there to receive him from us. And then they wheeled him in and started working. It does not have a 100% happy ending. Unfortunately, they were unable to reattach the arm. And what we were told when continuing providing, managing patients, next day when we got to, went across to the priority facility, the pediatric facility, and I spoke to one of the doctors there, and he said they could not attach the limb because of the type of separation. It was not clean cut. It was a really bad mangled separation. So it was part biting and part tearing. And because of that, they could not reattach the arm, but he was alive. And I believe he's alive today. I know there was a court case. Some sort of litigation took place. I did not follow up on it to see how successful. Yeah, no problem. School. All right. So that's the situation with him. So that's the end of the story with respect to that. Right? He's alive, but I think he would have gotten a prosthetic limb. Okay, so I don't know. I never followed up anything else after that. Okay. All right, so that's back to the chest pain. Again, if the person has their medication, let them take their medication. You can retrieve it, let them take it. Remember, we don't want to make any assumptions that it is not a cardiac related emergency. As long as it is chest pain, even on the ambulance, the only way we'll be able to figure out and confirm is if an ECG is done. Okay? So we're going to assume the worst case scenario, get help. Put them to sit down, loosen tight clothing, get help for them. Try to figure out what's going on, get a history. Okay. Any questions on that again? I want to move on to another one here. I'm just pulling up the video here. Let's wait. Okay, good. So we would have looked at asthma. We would have looked at a heart attack. We're going to look at a stroke now, right? And of course, part of it, we're going to discuss after the video. How do we manage a patient where we suspect they may be having a stroke? Right, so as usual, just let me know once it pops up on your screen.
Yes, sir.
All right, good. So I'm going to mute my.
Every 2 seconds, someone somewhere in the world experiences a stroke. And 1 out of every 6 people will have one at some point in their lives. Strokes deprive brain cells of oxygen and are one of the most common causes of death and a leading cause of preventable disability. When someone experiences a stroke, quick medical care is critical and can often help avoid permanent brain damage. But what causes strokes in the first place, and what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of the oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply the front of the brain, and vertebral arteries supply the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is interrupted, oxygen delivery stops and brain cells die. There are 2 ways this can happen. Hemorrhagic strokes are when a perforated vessel allows blood to leak out. But the more common type is the ischemic stroke, when a clot blocks a vessel and brings blood flow to a halt. Where do these clots come from? On rare occasions, a sudden change in heart rhythm prevents the upper chambers of the heart from contracting normally. This slows down blood flow, allowing platelets, clotting factors, and fibrin to stick together. The clot can be carried up towards the arteries and blood vessels supplying the brain, until it gets to one it can't squeeze through. This is called an embolism, and it cuts off the oxygen supply to all the cells downstream. The brain doesn't have pain receptors, so you can't feel the blockage itself. But oxygen deprivation slows brain function and can have sudden, noticeable effects. For example, if the affected area is responsible for speech, an individual's words may be slurred. If the stroke affects a part of the brain that controls muscle movement, it can cause weakness, often just on one side of the body. When this happens, the body will immediately try to compensate by diverting blood flow to the affected area, but this isn't a perfect solution. Eventually, the oxygen-deprived cells will start to die, leading to brain damage that may be severe or permanent. That's why it's important to get medical care as fast as possible. The first line of treatment is an intravenous medication called tissue plasminogen activator, which can break up the blood clot and allow blood to flow again in the compromised artery. If it's delivered within a few hours, this medication greatly increases the chance of surviving the stroke and avoiding permanent consequences. If tissue plasminogen activator cannot be given because the patient is on certain medications, has history of major bleeding, or the clot is particularly large, doctors can perform a procedure called an endovascular thrombectomy. Using a fluorescent dye that illuminates the blood vessels under a strong X-ray, the physician inserts a long, thin, flexible tube called a catheter into an artery in the leg and maneuvers it all the way to the blockage. A retriever is passed through this catheter. It expands and anchors into the clot when it's just past it. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out fast if someone is having a stroke. So how can you tell? Here are 3 quick things to try. 1. Ask the person to smile. A crooked mouth or facial drooping can indicate muscle weakness. 2. Ask them to raise their arms. If one drifts downward, that arm weakness is also a sign of a stroke. 3. Ask them to repeat a simple word or phrase. If their speech sounds slurred or strange, it could mean that the language area of their brain is oxygen deprived. This is sometimes called the FAST test, and the T stands for time. If you see any of those signs, call emergency services right away. Lives may depend on it. We're on a nonprofit mission to revolutionize education. Click here to learn how you can get involved.
Okay, so that's a stroke. Let me hear your questions now. You must have 1 or 2 questions. Come on.
So I'm still trying to get over the horse story. I don't know why. I don't know.
All right. Anybody else? I should have never listened to Miss Medina. She make
So
me
the
talk about it. I know
reason,
everybody's stunned into silence.
traumatized, sorry. No, the reason why I asked about the since we're going back there is because the which part the arm was cut off. I wanted to know how you control the bleeding, but you said
Right.
by the time you reach it was controlled. That's the only reason why I
Yeah,
asked.
there was still, like I tell you, it's just like about 2 inches below the shoulder joint, so there was still a little stump. But most of the bleeding had stopped with the shunting that the body did. So remember, it took us probably about 20 minutes from our location to get to where the incident took place, right? And during that time, all that time, he was bleeding. So when we got there, there was very little bleeding, actually. There was a lot of blood, but very little bleeding. Okay? So, all right, guys. So here what? Let's take a 10-minute break, and we will come back and discuss stroke. So that time you should be able to process the situation with the traumatic amputation, and you may be able to focus a bit on what we need to look at with respect to strokes and those things. All right? So let's take a 10-minute. Let me just pause the recording here. Okay, so let's chat a bit about this stroke, and from the clip you guys saw there, right? What is a stroke?
The blockage of oxygen going to the brain.
Right. So if you remember with a heart attack, there was a blockage of a vessel in the heart, right? It's the same concept when we're dealing with the brain. A stroke was previously called a CVA, a cerebrovascular accident. It's not called that anymore. It's called a brain attack or a stroke, right? Now there are 2 types of stroke. We have one where there's a blockage, right? And that's called an ischemic stroke. And we have one where there's a rupture of the vessel. That's called a hemorrhagic stroke. Both are dangerous. Okay, and remember, with a stroke now, the parts of the brain that get affected by the lack of blood from the blockage of the rupture of the vessel manifests in signs and symptoms with the body parts. Now, the right side of your brain controls the left side of your body. Left side of your brain controls the right side of your body. That's just how we are wired. Okay? And for simplicity, because this class here, we're down to the very basic parts of it. We'll leave it as that. Okay? Just hold 1 second, Miss Jordan. Right? I'll come to you shortly. Right. So that's how we are, and the effects of the stroke can be seen in functions or lack of functions of the various limbs and stuff. Yes, Miss Jordan, go ahead.
So this question might be a little too complex for this class, but can a stroke lead to an aneurysm?
To an
Aneurysm.
okay. I know of arrhythmia, right? I know of, oh gosh, the term, okay, just now. What, there was a term, I have it at the tip of my tongue where I just can't remember it. Oh gosh, yeah. Just explain exactly what you're referring to. Or the aneurysm, right? That's it, the aneurysm. An aneurysm could lead to a stroke. So thank you for that, right? Yeah. Thank you for that, Abigail. Right. So the aneurysm can lead to a stroke. And here's how. And with an aneurysm, there's a weak point in the artery, right? Or the blood vessel getting into the brain. And because of that, you're going to get, remember the blood vessel with the arteries, it's still under a certain amount of pressured blood flowing in there, right? With that weak point, you're going to get it bulging out. So I don't know if you've ever seen a car with a swollen spot on the tire, right? Let me see if I could pull up one for you here on Google Images. Yeah, very pronounced, right? So I'll just share here a quick image. Right. So if you're looking worst case scenario, right? You're looking at this one where the cursor is here. As well. So look at these on the outside. Right. So I'll just stop this. You guys seeing it, right?
Yes, sir.
Yes, sir.
Good. So when we're talking about an aneurysm, it is a bulge or a bulge in the blood vessel. Let me just get a picture of an aneurysm. Just getting drawings. I'm not getting an actual image, but that should work here. These should suffice. I'm gonna share image again here, right? Right, so what you're seeing here is an example on your screen of what, it's the same concept as the cat eye, right? Where there's a weak point and there's a swollen area that bulges out. Okay, so if you look at this one here, and this is in the brain, right? You get a weak point on the wall of the vessel here, and because of the pressure, it starts to swell out like that. Okay. Right, so let me just stop the share for a sec. Okay, good. So how can this lead to a stroke? If it is left untreated, the blood vessel could rupture at this point of the aneurysm because the wall's already weakened, right? And because of that now, when it ruptures, it is now a hemorrhagic stroke. Okay? So an aneurysm can cause a hemorrhagic stroke. Can the stroke cause an aneurysm? Logically thinking, it might be possible because if there's a blockage of the vessel, right, as in the ischemic stroke, let's say a piece of clot travel and block the vessel. If there's a weak point anywhere before the blockage, you could actually get the area swelling out and creating an aneurysm. Logically thinking, it could happen. Has it happened? I don't know because I've never done any research on it. Okay? It is not required for the class, you're quite right, but thinking about it, it is possible. Is there any data on it? I don't know because I've never researched it. Okay? Maybe if we decide to look, we might be able to find some data on it. Okay? But in effect, what we should be concerned at this point in time. So I hope I've answered your question, Ms. Jordan, but I don't think I would have given you all the information that you may require. Okay? Because I would not have done any research on that part of it. Okay? Right.
Thanks. Just looking at the fact that it deals with the blood vessels now, and I know
Yeah.
aneurysm is something to do with blood vessels,
Yeah,
and
yeah, yeah.
stroke is something similar.
Yeah, it's along the same line of thinking, right? So I think it's a possibility. I actually that's a very interesting question, one that I've never looked at. And I'll probably when I'm having our weekly meetings with our medical director, I'll probably shoot that one out to him and let me hear what his response will be. Okay? So yeah, let me hope I remember. I'll probably have to make a note of it to remember. Anyway, moving on. What do we do for someone suffering a stroke? Okay. There's an easy way to give us, I think, an 85% probability that someone is suffering a stroke. Anybody knows what it is? They would have looked at it in the clip. Anybody could remember what it is?
So the facial structure, the smile, if they could lift their hands
Right. What's the
and
acronym
speech.
we use?
I think it's face.
Nope.
I can't remember.
You're close, but you're not quite there. Anybody else? I know everybody was supposed to be looking at the clip.
Right. I think it's about your eyes, your face,
Right.
and
What's
then
the acronym called?
something about fast.
FAST.
Um,
Right. So, Miss Medina, you were on the right track, right? So it's FAST. F is for facial droop. A is for arm drift. S is for slurred speech, and T is for time to get help. It's called the Cincinnati Pre-Hospital Stroke Scale. It gives us, I think, an 85% probability that someone is suffering a stroke. Using that acronym and understanding what it is makes assessing your patient very easy. So when we look at the facial droop, we ask the person to smile. Why? Because we need to see the equal movement of the facial muscles. And if the person is suffering a stroke, remember, one side of the body gets affected. So there may be a crooked smile, or it might be unequal. Right? A, arm drift. Have the person close their eyes and lift both arms out. If, excuse me, if the person is suffering a stroke, the arms may not move equally. They may not come up to the same location, or if they come up, one might drift away. S, slurred speech. So yeah, this could go on the recording. That's not a problem. Anybody knows what slurred speech sounds like? So in all my classes I teach, and I've been teaching this for 2 decades, right? Easiest way, because we are in the Caribbean and there's no way to sugarcoat this, right? A lot of alcohol is consumed in the Caribbean. We know that. You guys ever hear somebody talk and we say they're really drunk to the point the tongue gets heavy? You guys ever heard that term?
yes, sir.
Anybody else?
Yes, sir.
Right. So it's they're unable to pronounce their words properly because of that level of intoxication, right? The slurred speech with someone suffering a stroke is similar to that because of the fact that typically when somebody's getting a stroke, the parts of the brain that affect that control or manage speech gets affected. So that's why they're unable to pronounce the words properly. So we ask them simple questions. Now you saw what you could do, we ask them, can you tell me your name? That should not take 1 second for the person to respond. But if you excuse me, if you realize that you're taking a couple of seconds to think, then obviously something is wrong. If they're unable to pronounce the words properly, especially making the O sound, right, where you need to formulate and move the lips and those things to get that sound, okay? And yeah, that's his slurred speech. T, time to get help. Get help. How far away from you from medical care? Okay. Sometimes they may have full paralysis of one side of the body or partial paralysis. Okay. In EMS, one of the things we do, it's not required in first aid, but in EMS, we hold both hands and ask them to squeeze our hands to see if there's any muscular deficit. Okay. But again, that's not necessary for you guys at this level. So getting help is critical, but please, whatever you do, we advise you to stay away from the home remedies. Putting a nutmeg in somebody's mouth, no. They're gonna choke on the nutmeg. Okay. I am not disputing the medicinal values of nutmegs and those things, but putting a whole nutmeg in the person's mouth could create an airway obstruction, and they could choke on that. Make sense?
Yes, sir.
Yes, sir.
All right. So that's a stroke. Let me see what else. So we looked at stroke. All right. So I think that's for those videos. I was supposed to look at. It's already 10:15. I don't think I'll be able to start the occupational health and safety lecture. All right. What I will do is at the end of class today, I will post this recording. I see that I am all alone at home right now and I have some free time here. I will post the recording and I am going to put on the e-classroom a couple of PowerPoints on the injuries, managing injuries, and I'm supposed to have a couple of videos on bleeding control and wound care. I will put those as well on the e-classroom. I'll probably put it as soon as this class is done. That said, next class, we are going to start the occupational health and safety side of it. You will have some videos on managing environmental emergencies and those things that you can very simply look at and you can be familiar with it. We could always have a brief discussion on it in class. But next week, we'll look at starting the occupational health and safety side of it. I believe I would have put the reference manual on the WhatsApp group, right? Correct me if I'm wrong. I think I would have posted it. Right? So you guys it's for reading material. But there's a lot of videos. I encourage you to take advantage of technology and of all the information that you would find on YouTube. There's a lot of educational information on YouTube, right? Not just entertainment. So you can start looking at some of the occupational health and safety side of it. We're gonna start next week with a brief history of how occupational health and safety came about. And then we'll look at some terminologies. And depending on how time runs, which should take us probably about an hour and a half. And then we will get into, I'll just swing back to the first aid side of it and look at burns. And if time permits, we'll just run the video on CPR and rack up that. And that should be the end of that aspect of it. Okay. Any questions?
No, sir.
All right. Have anybody else? Mr. Fraser, you've been very quiet in class today, boy. Still nothing?
So, trying to juggle work and
I know how that is. Say no more. Say no more. I understand 100%. So good luck. All right. So guys, ladies, just make sure you type your name on the chat because I'll be using that to enter the information on the register that I need to submit um to Lisa. All right. If there are no questions, that's it. It's 10:20. All right, we will resume next Saturday at 8 a.m. Okay. Let me stop the recording here.